Well, I'm joined now by the Health Secretary Steve Barclay. Good to talk to you this morning, Mr Barclay. Thanks very much for joining us on Sky News. Can I get you to confirm a story which is in this morning's Guardian newspaper, that 3 years ago, when Rishi Sunak was Chancellor, he blocked plans by the Department of Health to rebuild 5 hospitals that are affected by crumbling concrete?
Well, what Rishi Sunak as Chancellor put in place was a £700 million fund for RAAC replacement. That was put in place from 2021. In fact, we were on this issue early. We were surveying hospitals from 2019. And we've been following the Institute for Structural Engineers' advice, which is that not all RAAC has to be replaced. What we need to do is monitor it, assess it, and where there is a concern with deterioration, then it does need to be replaced. And that's why a £700 million fund was put in place. 2 schemes for full replacement of those hospitals were agreed, but further work was then commissioned, and a study from McDonald was then commissioned to assess the other 5 hospitals. Once we got that information, those schemes have then come into the programme. So a significant investment specifically in RAAC. And of course, this government has the biggest ever in the history of the NHS investment in the NHS estate, over £20 billion in the new hospitals programme as part of our wider investment in NHS capital.
So those 5 hospitals that the Department of Health had said it wanted help rebuilding were put onto the list of let's do a bit more research, let's put them on the back burner. But then across those 5 hospitals, there are more than 100 incidents where the actual state of the hospital led to clinical services being delayed or cancelled in the year after that decision was made by you and Rishi Sunak not to add them to the rebuilding programme. Will you apologise to patients who didn't have their operations because the building was crumbling around them?
Well, as I've just said, we put in place a £700 million fund to make replacements to RAAC. We commissioned further work. We commissioned further work into McDonald in terms of the extent of that. And that's because you have to assess whether it requires replacement of certain parts of a hospital or a brand new hospital to be built. Now, there's 3 hospitals where we've already addressed the issue of RAAC, where it wasn't the entire hospital that needed to be replaced. It needed certain parts, and we've already done that as part of our wider programme. So we commissioned McDonald's to do that further work. We put in place additional investment through the £700 million. And of course, it's this Prime Minister that is making the biggest ever investment in the hospital estate, over £20 billion. But of course, we should assess whether we're replacing concerns with asbestos or concerns with RAAC, responding to population growth in other areas with additional facilities. So there's a wider capital programme. We're putting over £4 billion a year into our NHS capital programme, a £20 billion investment overall. But we were on this issue early. We've been surveying the site. We've had a
sound like you're on this issue early. I mean, this was 3 years ago.
That is already clear.
The NHS was asking. These were 5 hospitals. I'll tell you which ones they are in case you've forgotten. Airedale General Hospital in Keighley, Hitchinbrook Hospital in Cambridgeshire, Frimley Park in Surrey, Leighton Hospital in Cheshire, and Queen Elizabeth Hospital in Norfolk. These hospitals were so bad that the NHS said that they needed rebuilding, and they were so bad that within the next year there were 100 incidents of those hospitals falling to bits around patients' heads. I mean, it sounds like you've put saving money ahead of patient safety.
No, I'm not sure you sort of heard the answer I gave just a moment ago, which is we put in place £700 million for RAAC replacement. The NHS came forward with a long list. But that is now.
I'm talking about what happened 3 years ago and why, when these hospitals said, we need help now, they were told, well, we'll just do a bit more research, we'll put you on the back burner.
No, the £700 million was put in place in 2021. It's a 4-year programme of RAAC replacement. It's already replaced the RAAC in 3 hospital schemes. It funded the 2 schemes of the 7 coming into the new hospitals programme. But there were 40 hospitals as part of that programme. There were a number of other issues that the NHS were asking for. That's why we're putting record funding in, the £20 billion of funding, the biggest ever investment into the NHS estate. But it's also right that we monitor this in line with the Institute for Structural Engineers' advice, and their advice is that not all RAAC should be replaced. What it should be is it should be inspected, it should be monitored, and where there is a deterioration, then it needs to be replaced. And that is the work that was commissioned through McDonald as part of the wider £700 million programme, and where the evidence then showed, in the case of these 5, further work was required in terms of a full replacement, they were then brought into the programme as part of that £20 billion investment.
I just wonder what changed in those 3 years. I mean, they're now on the list that's been graded catastrophic, with a warning that an incident's likely and that patients are risks of being evacuated. I mean, what would you say to those patients who are sitting there today who know that the government could have done something about this 3 years ago?
Well, what changed was that we had the work commission from Mark MacDonald. Quite often RAAC is in fairly concealed parts of a building. It may be in the roof structure. It requires further work in line with the Institute for Structural Engineers advice to assess whether there is a deterioration in terms of that RAAC, and that is the work that was commissioned. That often requires detailed inspection work by qualified structural engineers to understand the extent of a problem so that we can then prioritise that capital funding. So this is part of a 40 hospital programme. There's a whole range of other schemes that we're investing in, but where the evidence shows that RAAC is a specific concern. Firstly, we had the £700 million funding from 2021. That's already made progress in terms of 3 hospitals where the RAAC's been fully removed, but also where it was more serious in terms of these 5, then brand new hospitals are being funded, and we're committed to replacing those hospitals in full.
The government is today announcing £200 million to boost the NHS this winter time. Where's this money coming from and where's it going to go?
Well, this is additional money from the Treasury, recognising the challenges that we faced last winter and the fact we're putting in place much earlier plans. And we had a summit with the Prime Minister at Downing Street yesterday. It's the 3rd summit we've had bringing health leaders together. We're working much earlier. One of the things health leaders said to us is they want funding announced earlier to help them in terms of their preparation. That is exactly what we responded to. So this is additional money to the NHS, building on the significant investment the Chancellor made at the autumn statement, £3.3 billion extra a year last year and this year going into the NHS. And this is to help put additional bed capacity within the NHS, so 5,000 permanent additional beds. It's 800 new ambulances. It's also responding to patients, many of whom say they would prefer to recover at home. So 10,000 places through the Hospital at Home programme, enabling patients who have had an operation to then recover at home, but to have a safety net in place, using technology, using clinical support, so people can recover in the comfort of their own home, with their familiar surroundings, but have the safety net of knowing that there's ongoing support. So we're working in partnership with health leaders. We're taking decisions much earlier in terms of our winter preparation, and we're announcing today a further £200 million as part of those plans.
And that health summit that you mentioned there didn't include the Royal College of Nursing round the table. Did you not think they had anything useful to contribute?
Well, the Chief Nursing Officer, for example, Dame Ruth May, was one of the people there and the people that spoke. We had a wide range of leaders across social care, hospital chief execs, a wide range of royal colleges there. So there was a significant cast list of experts. Of course, we talked to very many other royal colleges, but a number of the royal colleges were represented. But in terms of your question specifically on nursing, the Chief Nursing Officer was one of the attendees.
Appreciate the clarity on that. Steve Barclay, Health Secretary. Good to talk to you. Thank you.